So hypnosis inevitably involves relaxing the nervous system, taking the nervous system into states that are more like sleep. Now, what I mean by that is in high alert states where you're talking and planning and in action and stress in particular, the brain is very linear. It's saying, okay, if this, if then that. This is why we tend to be forward thinking when we're stressed. We tend to be not in our immediate experience, but really kind of forward thinking. So clinical hypnosis involves going into a state of deeper relaxation so that our analysis of space and time, meaning the way that the brain is perceiving events, is slightly dismantled so that it's a little bit dreamlike. And then the hypnotist, and this could be by listening to a script or listening to a hypnotherapist, starts to narrow our context, take our thoughts, if you will, down a particular path. And that path could be one of stress reduction or smoking cessation. Hypnosis incidentally is very good for treatment of smoking cessation or for feelings of well-being or confronting traumas. So what it is it's really opening up the window for neural plasticity, which is, of course, the brain's ability to change in response to experience. To trigger neural plasticity, you have to have focus, especially as an adult. You need acetylcholine released, but high levels of attention, acetylcholine and norepinephrine together. Norepinephrine to create that sense of urgency and acetylcholine to bring that spotlight of focus in really, really tight. That triggers plasticity, but it marks certain synapses in the brain for change, but the actual changes in the synapses, the rewiring, okay, that happens during states of sleep and deep rest. So this is why when you're trying to learn a motor skill, you go and your tennis serve, it's not happening. You take a break, you come back and you nail it. You're like, wait, what happened? Well, you needed time to set those circuits in motion and allow them to do the rewiring, the sort of adaptation. Hypnosis seems to capture both the high attentional state and the deep relaxation at the same time. It's this very unusual state of mind where you're neither asleep nor awake and in tight focus or narrow focus. And it's very clear that it leads to these rapid changes in behavior because you're rewiring the brain. And the reason you're able to rewire the brain so quickly